The way we usually get a wrinkle on the skin in general is in very active, dynamic areas, such as me using the muscles of my forehead to elevate the eyebrow or to smile. We get the muscle activated. So when the muscle activates, that causes the movement of the skin getting small wrinkles. So the more and more I do this, the more we're going to get these little crevices from the muscle movement underneath the skin. When we do the forehead with Botox, we have to be very careful because if we do too much, it will drop the eyebrows. So at the most, I'll use 16 units. On a rare occasion, I'll use 20. Sometimes I'll use as less as 12, but on the average of about 16 units across the forehead. Also, when I'm using it on the forehead, I want to be careful to make sure I go far enough laterally so that I don't get the Spock look, where if we don't do this area, sometimes that the lateral forehead right over here, right in the brow, lifts up and you get more of an angled eyebrow. So it's more of a region where the muscles laterally are compensated for the muscles that are relaxing in the center of the forehead. 2, if we do this region here, the central glabellar area, we'll usually do 3 areas of injections over the corrugator muscle on each side and then the procerus muscle, and I'll do a total of 20 units. For the crow's feet, if I'm trying to also elevate the eyebrow, I'll use 10 units on each side and I'll give you about 5 injections. All the way from on top, go all the way around through here. Same thing. Just below the eyebrow, come around here. For the muscles, the little nasalis muscles that cause the bunny wrinkles, I'll usually put 3 millimeters on each side. Another area that I'll use Botox on a rare occasion is if I want to lower the lower eyelid, or if there's a really strong muscle underneath the lower eyelid causing a little bump, I'll inject maybe 1 to 1.5 units in that area. In the upper lip, across the upper lip for the little wrinkles, I'll inject at the most 4 or 5 units. Same thing with the lower lip, but on the lower lip I rarely do that. On the DAO muscle right here, I'll inject 3 units apiece. Each platysma muscle, and there's 1 band on each side, anywhere between 8 and 20 units on each muscle. For the micro Botox, it really depends, but I might put 10 units all across the entire neck, but I'll dilute it with a few cc's of saline. Sometimes for wrinkles across the cheeks, I'll use very small amounts of diluted Botox, maybe 4 or 5 units across a very large area. So these are the primary areas of how much and how many areas it will inject into the face and the neck.